Hi. Um, link. Okay, good.
Can you hear me?
Yes. Good. I
Okay.
was thinking maybe there's an issue with the link, so I wanted to make sure. I think it's just your link, but I'm gonna make sure.
Well, I had not registered for the Eventbrite. I didn't realize I needed to
No,
do
no, it's
that. And so,
okay. You
okay.
don't need to. Yeah. Just wanted to ask really quickly, how do you pronounce your name to make sure I say it correctly?
Yeah. Thank you. It's Brent Lavin.
Brent Lavin.
Yeah.
Okay, good. And I'm gonna introduce you. You can upload the presentation in the meantime if you have one and you want to.
Yeah,
Um,
I saved it as a PDF, so it would
okay, I
be.
think it's good. Just like screen share, it always has some issues, so
And then I just want to make sure, where do I upload?
you can screen share.
Oh, okay.
Yeah. Hi, El, we're gonna start at 5, so you can hang on for a few minutes.
Is that okay? You can see my screen now?
Yeah, it looks good. Yeah, it looks good.
Okay. And I moved.
Looks great. Yeah. Okay, good. That was easy. So people are gonna log on. I'm probably gonna start at a bit after 5 even, like 5:02, because people usually take a minute.
Yeah, yeah, totally
I'm
get it.
gonna just introduce you as a medtech expert and you can tell them more about yourself. Is that okay?
Yep. Yeah, that's totally fine. Yep, I got a slide in there about it. So
Okay, good. And then if anyone has any questions in the chat, I'll let you know. What do you prefer? We can do questions strictly at the end or
So I do have a slide for questions. I don't mind if there's a question along the way.
okay.
It kind of breaks it up. It's a little more so, feel free to just jump in. I'll try to leave a
Okay.
pause in there. So
I'm gonna monitor the chat, so if anything pops up, I'll let you know.
yeah, I probably won't see it. So
Yeah, yeah. Okay, that's why. Yeah. Okay, good. Do you have any questions for me or anything
no,
in?
just that you're recording it. Does it eventually go on the website then?
Yeah, and I can send you the recording also if you want to use it for your own. Okay, good.
Yeah, that was a little bit of my question is I would love to, use some clips.
Yeah, sure. I'll send it to you.
Hi, Brent.
Hey Ariel, good to see you again.
Good to
Hi,
see you.
Riel.
How are you?
I'm doing well, thanks. Yeah, now that we got the link working. So
Yeah, I think I sent you a different, like a temporary invite, and then I updated it, and good thing everything's working now.
yeah, we're fine.
Oh, looking forward to it. We have, I think, a lot of people registered.
Yeah.
Um, a lot from our own community. So really excited.
Yeah, I mean, no pressure, right? And
Yeah,
I will,
exactly. That was where I was aiming.
I will try to keep it. Um, it'll probably go 30 to 35 minutes is my guess, and then Q&A. So, and then we talked, if there's some questions, real time, Mia's just going to interrupt me because I think it's it's helpful to have a little bit of, if there's a question, just handle it right there, right? So,
Okay, great. Then maybe you should state it at the beginning then, and then
yeah,
people
I'll do that.
can write and Mia can ask. That's great.
Yep. Okay. Sounds good.
Terrific. So I read that your son is considering joining the military.
Yeah. Um, he's 17
Wow.
years old, and so that's a big life choice.
It
Is
is.
do you have like any military in your family, like background, or is it like?
So, yeah, my dad and father-in-law both served, and then my brother did more of the what we call the reserves.
Mhm.
Um, and as you know, in the U.S., it's more optional, right?
It is. It is, and it's exceptional. That people do. So
Yeah. Now, did you serve, Ariel? I know it's a little.
we all serve.
Yeah, it's
Yeah, that's what I,
mandatory.
I knew. Yeah, I knew there's.
Probably Mia was much more.
I'm not sure.
I think her service was much more effective than mine. But
I don't know. But we did, yeah. Everyone does here. Most
That's
people.
I knew that. Yeah, I've made it mostly through Startup Nation, the book, and
Mhm.
I learned a lot.
Really, that's nice. You've done research then.
Well, we talked about it. I mean, the innovation coming from your country is impressive, and I love learning from y'all. So
Cool. So first thing we start learning from you, and then and
yeah,
then maybe we'll be able to teach you something. I'm not sure about
no, 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 no. It's it's all partnership, right? And I'll talk about this too. Obviously, I give the perspective twofold of large med tech. So we tend to have more resources, but I also want to give the perspective of if we are your target exit strategy, this is the type of thing we're looking for. And so sometimes it may cost a little bit of money to do it a certain way, but you can reap the rewards, on the back end. So
Perfect. There's more than one founder in our community that will really identify with what you just said. Uh,
good.
Really.
Well, I'm glad. Yeah, it's been fun. It's been fun to put this together, put it actually down on paper, right?
Cool. That's great. And so after the session ends, then a couple of days after we upload it to our website and publish it, and we'll post again, of course. Um,
Yeah,
and then it's just out there.
yeah, I appreciate that. Thank you.
Cool.
Um,
Oh, I see some people joining. Hi, Ran. Ran and Ran and Shai.
Yeah. Hi, good evening.
Good evening.
Yeah.
I'm one of the founders.
Nice.
We've just been asked by our investors, potential investors, to present them our exit strategy. So I'm excited for the session.
oh,
We're gonna wait a few minutes for more people to join and then we can start.
Yes. Mia will give us the cue.
Yeah.
what is the local time?
5 p.m.
Okay.
Minute to 5. Yeah. Yeah.
Yeah. Okay, we'll wait just 2 more minutes for more people to join, and then we can start. Okay, I think we can start. So we have Brent Lavin with us talking about segmentation and targeting. Brent, I'll give you you can introduce, tell them about yourself and the presentation. We can start.
Yeah. Thanks, Mia. Thanks, Ariel. Thanks, everybody, for joining. So I'm excited to talk about segmentation and targeting, and I'm coming at it from the perspective of what large med tech companies expect. And so my goal is to provide some strategic and tactical insights in how you think about this segmentation and targeting when it comes time to your commercialization efforts. And while I think about segmentation and targeting both in the upstream context and the downstream context, I'll focus primarily for the bulk of this presentation on the commercialization downstream part. But in the end, I want to provide you the viewpoint of this large medtech company, if that's part of your exit strategy. And I'll give you a little bit more on my background, but this is the type of thing that large companies expect and can really help you as you approach to talk about these larger companies. And so I always like to start with the end in mind here. So if you can only remember 3 things from the entire presentation, here's what I'd like you to take away. Segmentation and targeting must be aligned with your business strategy. It's ultimately a strategic part of the process. It's a data-driven exercise, but it is done through an iterative process together with your management team, together potentially with your investors and board members. And then thirdly, it ultimately will prove scalability to those medtech strategics, and I'll talk more about that. So I don't want to go through my entire resume, but here's just a little bit of background on where I'm coming from. So I have about 20 years of experience across various strategic med techs. I started with GE Healthcare in the imaging space. Then I transitioned to Bard and ultimately BD, working on 510K biopsy products. But most recently with peripheral vascular PMA product portfolios, endovascular, arterial, and venous treatments, selling to interventional radiologists, vascular surgeons, and interventional cardiologists. And I really specialized on innovation, strategic product launches, as well as diligence and integration of several businesses, having been on the receiving side of 3 businesses that we bought, integrated, and ultimately launched into the market. So with that, I want to just go with a fun anecdote out of the gates here to demonstrate a non-medtech example of segmentation from my own personal life. So this is where the upstream and the downstream gets connected. On the left-hand side, you can see our parking garage here at the office in the US, and showing the sea of white Teslas. There's actually another one off frame there as well. But that's my smoke gray Ford Mustang Mach-E, which demonstrates the value of understanding how your customers are different when you're creating the solution. So Ford approached this product development program in order to offer an electric vehicle to a unique segment. It was frankly me, somebody that wanted something a little bit different as a commuter city-only car. And I was in the market for an electric vehicle. I initially actually drove the Tesla thinking that would just be the obvious choice. It had the dominant market share. They had the established infrastructure, but I was ultimately disappointed with that experience. There were no physical buttons, everything on the touch screen, no real character. And you might call me kind of an old guy about that, but I just was unimpressed. And so I kept looking and ultimately chose the Mustang Mach-E. It did have less range, less infrastructure, less features, frankly, but it was perfect for me, somebody that just wanted something for that in-city commute. And so my surprised Tesla owning friend said to me one time, "You'll never take that out of the state. You'll never go to California or one of these other states." But he kind of missed the point. I was part of a different segment of the market. But now converting that to the downstream process, the ad on the right shows how Ford is targeting me with their digital ads, right? So they know my demographics, they know my purchase history, my search history on the browser. So they're putting ads on the Wall Street Journal just for me. And so while it was impossible to catch that Mustang Mach-E advertisement at the time that I was preparing the presentation, the point's still the same. We need to be able to see our customers differently. We need to understand what problem we're specifically solving for that segment, and then structure our go-to-market strategy to be successful here in the US. And so just like that example above in MedTech, segmentation occurs both in the upstream and downstream, but ultimately they need to have alignment in order to be successful. The only thing that I'll say on the upstream side is that segmentation is really where you identify the unique patient populations and unmet needs that you're trying to solve, tying it to the clinical evidence and the regulatory pathway, and then pursuing the claims that you need to make so that you can convert it into the downstream process. And the remainder of the presentation is going to really focus on that downstream commercialization, where the goal is to identify those high-value customers, optimize sales targeting, and ultimately drive efficient resource allocation for maximum market impact, however that's defined by your company strategy. And I'll say it again, I've said it before, the ideal segmentation plan must be tied to your company strategy, whether that's maximizing early revenue, building a base of durable, repeatable business, gathering clinical data. The only ideal segmentation is one that benefits your company strategy. So why do we even need to worry about segmentation? The short answer, as I mentioned before, is it's all about resource allocation. So as you can see with the image on the left, what looks like one massive market opportunity here in the US is actually a really complex network of hospitals and clinics that I'm showing on the right-hand side. Even within what might look like the same category of, say, ambulatory surgery centers where you have 600 locations, there are a lot of differences between hospital-owned, physician-owned, and corporate-owned entities. They all act differently. So it can get complex very quickly, and a roadmap's absolutely necessary. I'd also say the same thing is true in Europe. What might look like a homogeneous region on paper is actually a heterogeneous collection of 40 plus countries that all have certain uniqueness. And I think people get this implicitly, but when it's time to come to market, there's so much opportunity, it gets exciting, and you tend to want to go after everything. I'm going to make an important aside on this slide here about the academic medical centers, because what I find a lot of companies want to target the very top of the pyramid, the very creme de la creme of academic medical centers. And it's tempting because there's only about 230 of them. And I'm actually going to show an example later where there was in fact the right strategy. I would say that academic medical centers can be a really challenging place as your beachhead because of access to the physicians there, the bureaucracy that's involved, and frankly, the fact that many of these are teaching hospitals. They stock a wide variety of equipment for those teaching purposes, and they tend to have everything on the shelf. And so it can be great for prestige, but it can take a long time to get in to those facilities. And then you may not get the utilization that you expect because they're trying to teach on every device out there. And so regardless of all that, having a roadmap is really crucial because time is money, and being able to assign resources to the right activity is the most essential activity at the time you commercialize. I will also say, I forgot to mention this earlier, the chat is open. And so Mia's monitoring the chat. If there's a question along the way, I do want to make it interactive. I'll obviously take questions at the end as well, but I did forget to mention that. And so if there's anything you want to get a little clarification on, certainly happy to do that. So here I'm coming back to this topic already that you really do need to start with the business strategy. I'd suggest that early clinical success is the baseline of any product launch. I think most people on the call would agree. you only get one chance to make a first impression, and you need to have solid clinical results in order to stand a chance in the market. So what does that look like? Some of those attributes will vary based on the specifics of your market, but I'd always strive to have physicians that are true partners. They're willing to engage in pre-procedure in-servicing. They allow the company to be in those early cases, and they know how to select those first patients. I'd be really cautious of selecting physicians that are pushing the edges of clinical practices. Many of the doctors that are writing the papers, doing the podium presentations, are really taking on the most complex patients, and that may not be the best place to start. I'll also say, and we'll talk a little bit about non-acute setting later, the outside of the hospital. That tends to be where you can have sometimes easier traction because there's less bureaucracy, but they tend to be also more focused on procedure time and some other elements that may be detrimental to getting the teaching and the in-servicing and the feedback that you need in order to be successful in those early cases. But beyond that baseline, there's a number of other factors. The possibilities are really kind of endless here, and I'll talk about that in a minute. I've just listed a few. I would say that depending on the scale and scope of your launch, you can really only optimize for one or maybe two of these factors. The more factors that you try to optimize, the more diluted your efforts become during that early launch period. And the most important element is to know why they're buying and what their experience is, to understand if you have the right target segment as your beachhead for this launch. You're always balancing the learning and that early experience with the need for speed to market and revenue generation. Personally, from my experience, our strategies in the peripheral vascular business lately have generally focused on gaining successful real-world experience while also having some regional training sites. The reason for that is we've been in established segments of the market with unique methods of action, but the procedures are very well known. So we want to get real-world experience and then have people be able to train others on that unique method of action. And then another thing that I would highlight is the reimbursement piece. And this has happened at our company a couple of times. I was not directly involved, but if your product is paid through a new or newer reimbursement coding, if there's any question about how the payers are going to receive this, you may want to optimize your initial go-to-market for success with those particular accounts that can get you some experience and some case studies that you can leverage later on in the launch process. So now I'm going to go on to a few more specific tactics and how to put segmentation in action. I'm going to show this a little bit later in a process flow as well. But as I mentioned, it's really iterative. And so this first step of the 3 steps is to basically put all possible segmentation criteria down on paper. It's to brainstorm, to write down all of the things that might be ways that you segment either accounts or physicians. And I've listed a bunch of possibilities here, but what my encouragement to you would be to go beyond simple demographics, beyond something that you can see on somebody's CV or their website, and really try to get into some of their thinking and behaviors in order to separate people into unique areas.
Brent, we have a question in the chat.
Yeah.
If it's okay.
Sure.
Rachel is asking, agree about challenges with AMCs, but on the other hand, they house the KOLs that can drive adoption through P2P education and hold sway with potential acquirees and investors.
Yeah.
Okay.
Yeah, and I'm going to show an example where academic medical centers was the right strategy, but it comes with the trade-off of, frankly, slower revenue ramp and maybe not as much early revenue as you expect because of the bureaucracy. I know you had a recent presentation with Mark Copeland, And the value analysis committees and the time that it takes to get through that process can be upwards of 12 to even 15 months sometimes. And so you may not get that feedback loop and early revenue that could also be helpful. And so it has to be tied to the company strategy.
Thank you. If you want,
yeah.
you can unmute yourself and Rachel, if you want, if that's answering the question. I think you can continue.
Yeah.
Yeah.
Okay. Great. So I would, at this point, really open up the funnel to ways that you want to think about your customers. I was interacting with a colleague at a different company, and he gave me an example where they did a segmentation based on early adopters and physicians that have a quality of life focus. And so they used previous sales history from their CRM to identify those that are most likely to be early adopters and to buy soon. And then they used qualitative feedback from field representatives to represent the quality of life. And they felt like the intersection of those two factors would be the most fruitful initial beachhead segmentation and target. And that's ultimately what proved to be the case. They were able to get 90% adoption within that segment very quickly because they use the data. The key point here is that I would not focus at this point on being constricted by what data might be available. I would simply reflect on who's going to benefit the most, what is the greatest unmet need, and then aligning that again with the business strategy in terms of revenue ramp. And then it's the next step, actually the third step, where we will go out and gather data. There's more data available today than you can possibly imagine, to be honest, and ways that you can use proxies to get insights into your customers. The next step is really where you create a rating system. This is the way that I've done it because I want to get objective data down on paper and to begin to iterate on this information. So here's a classic Pew matrix, and I threw a couple in there just as examples. Obviously, yours will be very different. But I have found, especially in my experience, that I want to get away from anecdotal evidence, from qualitative arguments with the sales team, and I want to get objective data down on paper. And this is the best way to do it, right? So what is your most important factor? What are the various tiers? And you can see, you could list this out, many more factors. And again, iterative. This is not going to be necessarily correct the first time that you go through it, but it's a way to start the process. I'll also say, I'm talking about beachhead segments as kind of your initial, what I would say target A, but you're also looking to establish targets B and C and how you're going to evolve through the market over time. And your messaging may change slightly for each of those B and C targets. And that's ultimately what you're hoping to do here in the exercise, is to have an A beachhead target with a really clear message and position, and then be able to proceed through your targets B and C. And this scorecard, however you quantitatively end up doing it, will give you those tiers of different customers. And then this is where it really comes to life. This is where you run the data. And I think you bring some objective evidence and intelligence to life that can ultimately result in that A, B, and C targeting strategy. So here's a couple of data sources on the left. And frankly, today, we have more data than I can even imagine. And there's probably more out there, and there'll be more in 12 months from now as well. Some of this will ultimately depend on your budget, and I'll talk about that in 1 second. But I have the most experience with AcuityMD there on the top. AcuityMD provides account and physician level data based on both CPT and DRG. So CPT is outpatient and DRG is inpatient data. So based on the procedure coding, it links it to physicians and facilities. They've also added within the last 12 months referral network insights, so they can identify physicians that are referring to the procedures that might be of interest, facility affiliations, and then patient journeys as well, so you can start to understand how patients move in and out of your procedures and how that may be changing over time. From my understanding, RepSignal and MedScout utilize much of the same data and have a very similar offering, but I just don't have direct personal experience with that. I'll say Definitive and IQVIA provide, as you may know, a much broader suite of products, but they've also delved into these DRG targeting data sets. Again, I just don't have personal experience with that. I'm also going to point out there's a website here in the US, if you're not familiar. Open Payments Data is a law that went into effect maybe 5 or 10 years ago, where manufacturers need to report fees and consulting fees and money that they pay to providers. And this can be a nice way to kind of research where affiliations may be located. If you have a particular competitor, you can find out maybe who they're paying for consulting or speaking events. And so I would just highlight that. Clinicaltrials.gov is also another way to tell who's involved in various clinical trials. And so you can get some insights there as well. Just a note on budget. I know there's a lot of constraints in the early phases and the go-to-market strategy. And I'm coming from obviously the big medtech perspective. So these data sets are not free. However, when you think about the time and resources involved in going to market, if you're ultimately targeting the wrong segment or calling on the wrong physicians, it can really, you can spin wheels very quickly and waste time instead of getting traction. There's also internal data. You know, at our company, we have an internal CRM, obviously, for years of previous purchase history, and I'm going to talk about an example with that. And then qualitative Salesforce surveys are really good as well. And so I would definitely integrate that in there. The last point is, you know, pull up your favorite AI LLM, and I think you're going to find a lot more rich data than you did 6 months ago. And I think in 6 months from now, you're going to find even more data. So again, just be creative, utilize the resources, and this is going to be, as I show on the next slide, kind of the most extensive step of this entire process. So here's a busy slide. Let me start out by saying this is, again, an iterative process. And I'm showing the ideal state. We don't always have this much time, but this would be kind of how I would approach it if I had, you know, a blank sheet of paper. So I would say 18 months before your commercialization, before your launch, really diving in and understanding your positioning. I'm not talking about that today necessarily, but this is getting your claims down on paper, understanding how you're differentiated from the competition, rooting your claims in clinical or non-clinical data, being certain on what you can say from a marketing and sales standpoint. But then the real work of segmentation, I would say, is about 9 months total, followed by 3 months of targeting. And you can see here, aligning on the criteria and strategy at the front end might be 2 months. Again, by the time you have various meetings and pressure test that, creating that rating system kind of in the middle, that should be a pretty quick 1 month process. Maybe it's shorter than that. But the data, sourcing the data and iterating on that data is going to take a good 3 months. I would also assume you want to go back to the beginning and continue to refine as you get things down on paper, as you learn, as you talk with your management, with your board, maybe with your field teams or distributors, as you go through that. It's not a linear one and done kind of process. And then the targeting step there is about, again, 3 months. And this is where it's going to be very sales heavy, or taking the data from the segmentation exercise, you're putting it into specific account lists. You're putting action plans behind those accounts. You're creating shared dashboards, ideally, so there's good communication that are updated consistently, and they have clear KPIs and targets for how to execute on those. More can absolutely be said about the sales enablement piece. I'm not going to go into that necessarily today, but I just wanted to say that you can see along the bottom, as you progress through this process, it becomes much, much more of a sales exercise. And again, together with marketing, but it becomes a sales handoff as you come to market. I'll also say real quick, here's some signs that your targeting may not be ideal as you get into that launch process. Lengthy sales cycles, things that take longer than expected, high churn rates. You get initial demo, trial, maybe even initial utilization, but then you get drop off. Product requests that are never ending. If you're constantly getting product feedback, and I don't want to dismiss that, but that just might indicate you're not at the right segment of customer for that product. And then I would say, I'm going to talk a little bit about this later too, winning deals outside of your target segment. That's attractive, right? That's revenue. But that also indicates you may not have that ideal customer identified. And ultimately, it may be tough to demonstrate scalability to a medtech company as they're looking at an acquisition. I'll say this again later. The more that you put into this process, and the more you document on shared dashboards and have KPIs, it gives you a barometer of how you're doing and adjustments that may need to be made. I'd point out that continuous feedback loop. I'll give an example with Rotarex in a minute. We adjusted our messaging about 3 times over 36 months based on feedback as we progressed through the launch and as we progressed through the priority segments that we were targeting. So with that, I want to keep moving in order to be able to get to the Q&A. Just a really quick real world example. This is not one that I was involved in, but it's been documented in several publications, and I thought this was a good example of iRhythm when they came to market with the Zio, which was a single lead ECG patch for detecting arrhythmias in place of a Holter monitor. And this is the example I mentioned before. Academic medical centers were absolutely the right beachhead a segment for them because they were trying to displace the Holter monitor. And so it was a great clinical fit where they had the largest unmet need, the most pain, but it could also get them credibility through publications and podium presence. But at the same time, that early revenue ramp was very slow. Once they were able to get that traction in the 230 centers, then they were able to move on to the EDs and the PCPs. And so where they eventually developed a 2-tier sales structure, but they had to understand their positioning with those medical centers first. And it would have been easy to be distracted by the primary care centers, the 160,000 practices, but they would not have adopted that without strong clinical data and a signal from those AMCs. So that was a situation where it was absolutely the right strategy to pursue. But on to 2 more examples that are more kind of close and near and dear to my heart. This is the Rotarex atherectomy system, where we purchased this through an acquisition in 2020, and we brought it to the US market for the first time. So it was going to be the 7th device on the market in that particular segment. So we really needed a sharp segmentation and targeting strategy. So we started with the unique method of action where it performed well clinically. it worked well in less than severe calcification, as you can see with the charts on the right. It worked best in the mixed morphology, in particular in-stent restenosis cases. So we built a segmentation based on volume of procedures, where we had existing BD sales, as you can see here, and especially sales in multiple categories. We got local intelligence on who was the competition and how strong was the competition in that account. And then we built a tiered approach based on physician specialty and site of service. And so we initially chose to go after the office-based lab, the non-acute, non-hospital setting, because we wanted to get early revenue signal. And then we proceeded to target the physician that practiced in both the OBL and the hospital, and then eventually branched into the hospital over time because of those value analysis committees. So that was a really strategic tiered approach, layered on with those other factors that I mentioned. The result was frankly the most successful integration that we've had in the last 5 to 10 years, where we gained about 15% market share and exceeded expectations. Just really quickly, again, I'm going to touch on this. This is a pure downstream example of segmentation and targeting that was enabled by the Acuity MD platform. The true PTA catheter here, balloon, is used for balloon-assisted valvuloplasty prior to a TAVR. And while we had decent market share, we also had a wide range of pricing in those accounts. And so we created a 2x2 matrix using the Acuity database for those TAVR CPT codes, and understanding what degree of share we had for those procedures in that account, layered on with our ASP from the internal CRM. And you can see here, we had various segments and a dashboard together with sales where we could assign actions at the account level. If they were high share, high price, we were going to do nothing. If we were high share, but lower price, so that can be an okay thing. We just need to monitor the share. And then, but if they were low share, low ASP, that would obviously be immediate action required. And so just an example of using data together with the Acuity database to help direct the sales teams in their actions. I just have 2 more slides here, I think. So, the real cost of segmentation, I think on the left, is kind of our traditional approach. At times, we'll sell to anybody that'll buy. All revenue is good, especially in the early stages of a launch. We have the greatest solution in the world. All hospitals will be interested in this. But as I mentioned before, there's a lot of variation in the types of hospitals, types of specialty. And so we really need to understand who is going to be most attracted to that solution. And then we'll prioritize later down the road. Once we get some traction, we'll prioritize. But here's the key point that I'll make on the next slide as well. It can lead to no repeatable sales processes. There's a lot of resource inefficiencies in calling on the wrong customer. And there's that lack of consistent feedback and uncertainty about who and why they're buying. And ultimately, the strategic medtech company wants to have confidence in an operationalized approach that can be scaled across the sufficient market opportunity to justify the acquisition price. So this is the last slide here. Some key elements to consider for identifying successful segmentation. On the left-hand side are some key attributes, and the right-hand side is kind of what success looks like. And again, what a strategic medtech would be looking for. We're looking for alignment of upstream and downstream segmentation strategies, that the initial product features and commercial model are aligned with that beachhead segment. And then you have a really clear and cogent path to go towards those B and C segments, together with messaging that's specific to each segment here, that you have differentiated messaging. As we went from the OBL to the hospital with the Rotarex launch, we needed to adjust our messaging, and we did that. Having a really strategic view of that segment priority and pipeline, so having a dashboard and metrics, things you can point back to, that you can talk to the demo, in-service conversion, and ultimately maintenance and lowering your churn rates. All of that goes a long ways to demonstrating to the strategic medtech company that the product solves an unmet need for that segment, and that it's ultimately scalable within the commercial engine of that company, that it's repeatable, and that we can take it to the next level. So with that, I've gone through a lot in a short amount of time, but I did want to leave enough time for questions. And so you can see some of my contact information. I'll just say the best way to reach me is through LinkedIn. I love having conversations. I love learning, and certainly willing to help out, lend perspective. I'd be available to anybody that wants to chat. You've got a couple of ways to get in touch with me there, and can certainly take a couple of questions. Mia, is there anything in the chat?
Not that I see, but you can also unmute yourself and ask if you want.
Brent, I'm curious if you can go back to the rating system and expand a little bit more on how you do that.
Yeah, the rating system. This one.
Mm-hmm.
Yeah, I think again, I'm showing a couple examples that are pretty straightforward, but I think it's iterative, and it's trying to get some initial things down on paper. And to a degree, you don't know what you don't know until you start putting it down. And so I'll just give that example from the RoadRx launch. While I think it's attractive to go after office-based labs that have very high annual number of procedures, they also typically have the most competitive intensity and the lowest margin. And so you need to balance both of those. And as a business strategy, you need to understand what's more important. And so I think often we get attracted to the large volume, the large size of opportunity, but it's got to be balanced with what's the competitive intensity, what margin are we gonna, is the physician specialty the correct specialty? And so again, just in that example, we felt like vascular surgeons were going to be the most receptive to the RoadRx system because of their method of action and some of the cases that they were doing. And so in that case, the vascular surgeon would be the highest at 5. And so the other piece I would say on this practically is this is in partnership with your sales team. And again, I'm coming from more of a large medtech perspective where we have, separate teams and all of this, but it has to be done together with them because they have to buy in on it. Because ultimately, when you create the dashboard, everybody kind of has to have agreement that these are the priorities and this is how we're going to track them. Does that help, Alex?
Yes, thanks. This is sometimes
it's just
get alignment within the organization on this, and the research maybe helps to get a better idea of how to do it, how to do it right according, in alignment with your strategy.
Yeah, and let me also say, I've put it in terms of, kind of this rating system, but I think you bring up a really good point, which is a lot of this is influence and working within the organization to have alignment. And so when I've had struggles with that, I've always gone back to the upstream process and reminded people of why we created the product, what our business strategy was, but then also we've typically conducted some market research as part of that. And I point back to the market research that says this is the best way to go about this. And so, it's it's obvious, but not, marketing is not always right. Sales is not always right. Finance is not always right. Strategy is not always right. It has to be, a blend of all of that. Thanks for the question.
I just wanted to ask about the execution in reality. I understand, of course, the importance of the right segmentation, but sometimes it's also up to the sales rep that you have in the particular geography and his relationships with that hospital. So just as a company that is going through this and kind of trying to do what you're speaking about, at the end, it depends so much on these relationships and whether you have the right person in the right geographical region. So you could, and sometimes you end up with a hospital with a tremendously long VAC procedure, but process, but you don't have you don't really have much choice because that's how they all are working in a particular geography, and there's no point in going to like some kind of third tier hospital where you can maybe get in easily, but they hold no clout.
Yeah, it's such a good point, and it's so hard to judge. To your point, what I would say, first of all, is relationships are important, but I do think at times we over-index on those, and so relationships help get access, but sometimes getting access to the wrong customer doesn't do us any good. And so sometimes we got to go develop the relationship for the right customer. So that would be kind of one comment. I've just seen it in experience where our field team tends to go, salespeople generally want to go where they feel comfortable, and that may not be the right target segment. So that helps baseline it. I would also say the shared dashboard is really helpful because it drives visibility to the steps of the process. Have we called on them? Have we done the demo? Have we started with the VAC? And even though it takes a long time, what do they say? The best time to plant a tree was 20 years ago. The next best time is today. If you don't start the value analysis committee, you'll never get to the end. And so if that's your target segment and it's a long VAC, you at least got to start that process before you go chase some third tier opportunity, Rachel, to your point, that might give you some early revenue, but it doesn't give you long-term traction. So we could do a whole presentation, and there's a lot smarter people about kind of that sales component of it. I've obviously worked in conjunction with our sales team, but understanding the demo, in-service, conversion, and maintenance phase is crucial. So
we actually have a question from Shiko. Are you still with us? Do you wanna ask?
Yes, sure. Hi, great presentation. Thank you for that. Really puts a lot of things in place. I wanted to ask, how do you add a strategic collaboration as part of the thinking workflow of segmentation? Where do you put that in when you're thinking about it?
Yeah, can I clarify, Shiko? I think it's a really good question. Are you talking about like a distribution partner, or are you talking about
well, I believe all options are part of the, because you can go to a strategic in the beginning, and then it could be a little bit more than just distribution, and sometimes you can think about the end process, that you reaching the market and you have the already matured product, and then it's distribution, but you're aiming to that point of being acquired, like you said in one point of the presentation. I think this is something that you need to take into account when you're doing the segmentation part.
Yeah, I actually had that in my original talk track, and I took it out because it's really hard to know how to approach this, other than to say, if you had a strategic where you were having, say they had a strategic investment in your business, and there was the possibility of an exit. We often thought about how a product line helps our entire portfolio. And we ultimately want 1 and 1 to be 3. And so if your goal is to exit to a particular strategic or a particular set of strategics, you may want to have that element as part of your targeting exercise to say, how can I help and not hurt this strategic along the way? And so I'll just give a real life example. Again, back to the one I talked about was Rotarex. You know, it's complementary to our PTA and drug-coated balloon and stent product lines. And so how, you know, hypothetically, could you align with some of the accounts where we had strong sales in those areas? Now, there obviously has to be rules of engagement between the companies. They can't share sales data with you, but it could be part of your thought process, if that makes sense.
And how would you put that on a later part of the segmentation? You know, like when you're thinking about the downstream part, how would you take that into account? How do you take that into account? You know, because if you have ultimately wants to be acquired,
yeah,
and you have those, well, like you said, I'm segmenting the market and I'm saying who are my first target, second target, and third target. Strategic are also part of this, or either doing the same kind of thinking themselves, or should be a part of this segmentation as well. Because you're thinking, you know, Medtronic are only selling for those kind of customers, and I want to be eventually to consider to be a good acquirement for them. Do I need to put that as part of my thinking process when I'm choosing where is my segmentation supposed to be, or how my segmentation is supposed to be?
Yeah, Shiko, I'm not sure I can give an exact answer on like how to do it, but I think you should do it, if that makes sense. And so it could be a qualitative rating, or it could just be a qualifier to say, you know, we will only target accounts that have this type of profile, you know, whatever. You know, they maybe have this imaging system, you know, as an example. And so there might be partnerships, to your point, where you work together with imaging in order to come to market. And so you want to be associated with accounts that have XYZ MRI machine or a particular mammography system. And so I don't know how to do that prospectively necessarily in general, but I think it can definitely be part of the process.
Okay, thank you.
And Chico, happy to take this offline too and just kind of brainstorm about how to think about it. I would also say there's likely more data out there than you may know about in order to learn some of that information.
Amazing, thank you. I will.
Do we have any more questions? Okay. Thank you so much, Brent. The recording will be available on our website as usual. Thank you. It was an amazing.
Yeah, thank you so much. And again, reach out if you want to have a separate conversation. I love the opportunity and wish you all the best.
Thank you very much.
Thank you.
Thank you.
Thanks.